So thank you, Tom, for being here. We're going to discuss CARE1 from a patient perspective. So first, can you introduce yourself?
So you know me.
I do.
But I'm Tom Powles. I'm an oncologist in London.
Thank you for being here, Tom. So you'll be the point person for CARE1 in the UK. And so can you speak to our patients? So what is CARE1? What is the goal of this trial?
I think the goal of the trial is quite important, actually.
Thank you.
And I think we're answering it in a robust way.
Right.
We've done lots of trials in the past which haven't answered questions in a robust way, but this is that, 1,000 patients, and we'll get an answer.
So it's patients with metastatic kidney cancer.
Metastatic clear cell kidney cancer, the commonest type of kidney cancer, number one. Number two is we have two regimes approved globally, two broad regimes. One is immune-based therapy, two immune therapies, and the other is immune-based therapy with targeted VEGF-targeted therapy. And there is a lack of clarity about which of those two approaches are the right approach, and actually there's debate. The reality is I'm fairly convinced, and you're fairly convinced, that some patients benefit more from one and others benefit more from the other, but we don't yet know who those patients are. So what we are going to do is we are going to use a biomarker called PD-L1.
So what is a biomarker? This is for patients. What is a
A
biomarker?
biomarker is a test, and it's a test that you can perform on tissue. So essentially what you can do is you can get a biopsy from the cancer, you can test it for special proteins. One of those proteins is called PD-L1, and we think PD-L1 is an immune biomarker, and we think the pure immune therapy will work better in the PD-L1 biomarker.
So ultimately, it's to demonstrate that by using this tool,
Yes.
we can better select for patient which way to go, right?
Which of those two options is best?
Yeah.
With the immune biomarker, does the pure immune therapy work better? Quite a simple question. And in those patients who don't have that immune biomarker, do they need both treatments?
So as of now, we need to demonstrate that. So we need patients to take part into this trial, which will be starting soon in the UK. So it's coming shortly now. You'll have 10, 15, maybe more centers in the UK. But it is what we call the pragmatic trial. What does it mean, pragmatic?
Well, I think it's a pragmatic trial. From my perspective, I think it's an easy trial to perform. I think that the treatments are the standard of care.
So it's easy for the patient because it's routine standard of care treatment.
There are with the exception perhaps of measuring that PD-L1 expression in the biomarker.
That doesn't rely on the patient. It relies on looking at the samples.
Sure, but
biopsy,
there
stain.
are additional tests, and actually the treatment patients are going to get is within the context of an NHS standard treatment, standard of care treatment.
So standard treatment, so meaning no increased risk, right, to take part in the trial?
Right. No, I don't think there's any increased risk in taking part in the trial. I'm fairly comfortable about that.
Yeah. So basically, because we are comparing standard of care, we're not exposing to additional toxicity. We are using the agents available in routine practice, and we are comparing them.
Yeah, and we know patients who take part in clinical trials actually do better than those people who don't take part in clinical trials. And that's because we have a protocol which we have to follow. It's very robust. We have to do specific imaging at specific times. We have to make sure we've done all the tests properly. And patients on clinical trials get an additional team. They get a research team on top of the NHS team. And that's one of the reasons why taking part in a clinical trial is attractive, because you get more support, you get a pre-specified cookbook of what's exactly going to happen.
The protocol.
The protocol. And that protocol means that we have to abide by that. And that's one of the reasons why I think there's an advantage in taking part in clinical trials. And CARE1 is a good clinical trial.
Thank you, Tom. So patients with metastatic kidney cancer can be proposed this trial by their oncologist in the UK. And of course, feel free to ask questions to their physician. And hopefully we hope that this video would have been useful for you all. Thank you very much.